Welcome to the UN Brief. Today we interview Vinayak Prasad from the Department of Health Promotion at the WHO here in Geneva. The WHO presented a report on the fight against the tobacco epidemic. The report also highlights threats posed by new nicotine and tobacco products. While countries are making progress in curbing tobacco use, the report revealed that some are not addressing emerging nicotine and tobacco products such as e-cigarettes and are failing to regulate them. Another area of progress, 5.3 billion people benefit from the adoption of legislation that protects them from nefarious effects and prevents use of tobacco among pregnant women, for instance.
One of the tasks which we do is to monitor policy progress across all the 194 countries in the world, which are member states of WHO. Every 2 years, we bring out this report. So since 2007, we have been releasing these reports which show policy progress. Policy which has moved forward in the last 2 years are warning labels, pictorial warnings, graphic warnings on products. We have 101 countries now with policy, these warning labels at the best practice level. The only policy which seems to still be stuck down is tobacco taxation. It's the most effective, but it's the least implemented. So that's
why is that? Is that you believe?
So a couple of things. One is that the tobacco industry fights tooth and nail for every tax increase in the world. Every country they fight to argue, saying, "Oh, smuggling is going up, illicit trade is up." So it's sometimes it's capacity issues, sometimes it's political for governments to be able to raise taxes. Sometimes it's regional compulsion, because many of the policies can only move in taxes if the rest of the regional bloc move. For example, in SADC, South Africa, and the 6 countries. For example, in West Africa Monetary Union, or EU.
So the report has focused also on electronic devices that deliver nicotine. Studies have revealed in the last couple of years that these products are even as harmful, if not more harmful, than actually smoking cigarettes. And the other issue is that their marketing is targeted towards children, towards young adults and adolescents. So what are some of the issues that were encountered during your research?
So we've looked at the progress. We cannot make a global trend because only 56 countries are regularly monitoring e-cigarette use. More countries need to start monitoring, how many children, how many adults are using these products. But from these 56 countries, we have enough data to see that the use of e-cigarettes is going up. It's still low, between 2 to 3% global average. Some countries have gone very high, in Europe especially, but otherwise it's generally 2 to 3% regular users of these products. What we are seeing is that the 32 countries have banned e-cigarettes. We have another 79 which partially regulate e-cigarettes. Now, when I say partially regulate, is some will make it difficult to smoke in public places, some will have warning labels. So we have, out of those 79, 9 countries that have banned flavors, for example. So we can have, we still have more than 70 countries, plus the 84 countries that have done nothing. So we have a number of countries which have not done anything on e-cigarettes. They don't regulate it. So for the tobacco and nicotine industry, it's a nice opportunity to keep pushing their products because they're not being regulated. So most countries, for example,
are these the multinationals, the Philip Morrises, that are
all
pushing
small,
products?
big.
because Philip Morris just came last week with a declaration that they were within the next 5 years transform the company into a health and wellness company. So that means they would be abandoning tobacco completely and moving into, therapeutic products, herbal products. It was a little unclear to me. Did any of the research in the report looked closely at how the big tobacco is addressing the issue? Because they are, at the end of the day, they are the ones that can really do much more together with governments.
So number one is they have created the problem. They are now trying to give solutions. And the solutions don't exist the way they are promoting it. One, they're targeting children. We are seeing that, and we are seeing from that if the children take to e-cigarettes, then their chances of becoming regular conventional smokers is 2 to 3 times higher. So you're basically making a new group of addicts.
Yeah, but Article 5.2 of the Framework Convention on Tobacco Control obliges parties to implement measures to effectively prevent and reduce the harmful consumption and exposure to tobacco.
Yes.
And the other products, such as electronic cigarettes. How does WHO and country members can actually make sure that the Framework Convention is respected?
By saying no to all forms of tobacco, by saying no to all forms of nicotine. We want to protect our next generation. We need to regulate these products. We should not fall for misleading claims by the tobacco and nicotine industry. All these products are harmful.
Thank you for watching. I'm Maya Plant, and this is the UN Brief. Don't forget to subscribe.